When the nose grows, particularly in the snouted animals, most of the growth takes place on the nasal bone side rather than on the frontal bone side. With extra oral traction in high convex spaces, we actually move the nasal bone. Now, most people don't know that. It's very difficult to get some people even to realize that it's possible. But the nasal bone comes into prominence because also it is very important to our breathing. Anyone that wears glasses has had the experience of having the glasses drop down here and have trouble breathing. In the nasal bone, this little notch is a valve. Do this and see if you can see at least what I do. Take the notch and push it, and then try to breathe. Right at the nasal bone where the notch is, push it in. You find a restriction of air. See that? Isn't that interesting? Push this up, and you breathe very easily. So this valve is part of the resistance that's necessary for normal breathing. When we normally breathe, there is a pressure inside the nasal cavity. When that gets restricted, there is a vacuum produced, and you get a collapse of the nasal cavity. So it is important to the physiology of breathing, and we get involved with it in orthodontics because we change it with treatment. But particularly in Anglo-Saxon and particularly Mediterranean peoples, they have very large noses and very prominent humps in the nose. I don't know how much rhinoplasty is done in Japan, but my guess is very little. The width of the nasal cavity in Orientals is about 5 millimeters wider than it is in ordinary Caucasians. So your noses are wider and not as deep. Most of those people hate their noses because it dominates their face. And so particularly in our race, we have an awful lot of rhinoplasties done. There's many ways of performing the operation. And some of them are not good because some of them ruin this valve right here. We have some cases that have been stable for years and go and have a rhinoplasty, and suddenly their orthodontic cases collapse. Anytime a patient becomes a mouth breather, you've got a problem if it is of long duration and continuous. So don't let me forget to talk a little bit about mouth breathing, thumb sucking, tongue thrusting, and the oral environment. Because from a biologic standpoint, it is right at the very heart of bioprogressive philosophy. It's just not a matter of straightening teeth. It's a matter of obtaining normal function. And in our book, breathing and our respiration is every bit as important as chewing. So we'll be talking about that and paying attention to that in our diagnosis. Now it's good to look in the lateral aspect of the nasal cavity and get it very clear in mind where the different ducts and sinuses enter into the nasal cavity. If you stick a probe in the lacrimal duct, first of all you see how large it is. It's just not a small little hole. It's actually the drain for the eye, and it comes out under the inferior concha. So the lacrimal gland drains down into the floor of the nose. So you go to a movie, see a sad movie, everybody's blowing their nose. So, because it pools right in the floor of the nose. Right now, the maxillary sinus opens up above the inferior concha, between the middle and the inferior turbinate. So when you get a sinusitis, it involves your nose a little bit higher than it does when your eyes are watering. All right? Now, the sphenoidal sinus empties right above the middle turbinate. And the frontal sinus empties right at the superior turbinate. So if you have accidents or if you have problems in the nose, a child gets something stuck up in the nose, it's good to understand a little bit about the anatomy of the nose. You're still a doctor. This is in and around the jaws, so you should know something about it. I had one mother bring a child to me one time, and the child's breath was terrible. He had also had a little breathing problem on one side. So a chronic sinusitis will give a chronic bad breath, and it is quite offensive. So I immediately suspected maybe that he had a chronic sinusitis. So we started to examine him, and we noticed something red up inside his nose. So I took a pair of tweezers and went into his nose and spread his nose out and pulled out an eraser. Eraser? Yeah. Little kid has stuffed an eraser up his nose. We had another mother come in. And she said one of the kids was having trouble with his ear. She said there was something green in his ear. He'd stuck a bean in his ear. And it was sprouting. I was, and I had a very dear friend bring me an x-ray one time, and there was a metal object in the frontal sinus. He says, "What is this? It's been in there for a year." I looked at it, and immediately I knew what happened. It was one of these weights that you put on a fishing line. Little lead weights. Had a little groove in it, you know, like you pinch it onto the line. He'd stuffed it up his nose, and it had gone all the way up into his frontal sinus. That's lead. That could have been a real source of some poison. So they operated him. Sure enough, it's just what I said. It was a piece of lead weight. So kids stuff things in funny places. I had another one come in one time. She had swallowed her retainer. Don't you think they can't do it? And one of the clasps on the retainer had gotten caught in her tonsil. So we had to go in. She was gagging, you know, and everything. So we had to go in and take it out. I had another patient come down from Central California, and he had chronic nosebleeds. So he was a cleft palate patient. So I was the only one around that was treating cleft palates in those days. So I took a frontal and lateral head film on him to see if I could see anything irregular about his nose. His nose didn't bleed chronically, but every time he blew his nose, he had blood in his discharge. When the surgery had been done, the maxilla had been rotated. So he had an upper canine on the cleft side erupting upside down, and it was erupting into his nose. And it was bringing the gingiva with it. So he had gingivitis of the nose. He had pyorrhea of the nose. I said it's a hard place to get in and brush. There was one case I took the canine out. That's the only one. The point is that we are involved in the nose. And if we hang up our shingle and call ourselves a doctor, and particularly an orofacial orthopedist, we're involved in the nasal cavity, like it or not. When the surgeon does a Lefort procedure, the cuts are made through the nose. We go through the oral cavity to get there, but the cut is made through the nasal cavity, so it is not an oral operation. The oral cavity is left intact. It's an operation in the nasal cavity. So we become involved with the nose, particularly in current orthodontics. Frankly, I don't know what all of your rhinological problems are in Japan. But I'm sure you must have ear, nose, and throat specialists. And I'm sure you have allergies. And I'm sure you have chronic rhinitis. I'm sure you have polyps in the nose. And I'm sure you have a lot of other infections in the nose. One thing that sometimes people will confuse with the lacrimal bone is that they will see a little loop there. Some people have selected that erroneously as orbitale. So make sure that you see where the lacrimal bone is. Notice it's on a level with the bottom of the nasal bone. Now the ethmoid bone is a central bone in the nose. It is the bone of the nose. Actually, the nose has 21 functions. A friend of mine who started the American Association of Rhinologists visited my office one day when I had a course like this. And he presented himself at the door. He was showing a colleague around Los Angeles and came to the door to say hello. And I says, come on in, why don't you give us a little talk? And he said, well, what about? I said, on the function of the nose. He said, well, there's 21 functions. Which one do you want me to start with? So I talked about 30 minutes about the importance of the nose. Now, the interesting thing is we don't have one nose. We have two noses. There is no communication of one nasal cavity with the other. What we have when we have a cold sometimes and we lay on one side and that nose gets plugged up, then we lay on the other and something runs over to the other side. Fluids are passing from one side of the sphenoidal sinus to the other. And the communication one side to the other is through the sinuses, either the frontal sinus or the sphenoidal sinus. So we don't really have more than one nose working at a time, he says. We think that our noses are working symmetrically, but one side of the nose will hypertrophy and the other will atrophy a little bit in the mucosa. For instance, hold one nose. You may have free passage. This nose now is my dormant nose right now. So the noses shift. I didn't know that. And so when you have a patient that you examine, you have to understand that the passage of air on one side may shift. But you can have a chronic problem on one side. And it may not be too much of a problem sometimes, but when the other side goes into a period of so-called rest or whatever it is, an engorgement with blood and hypertrophy of the mucosa, then you've got a breathing problem in that patient. Now there's not a lot of weight. There's not a lot of bulk to the ethmoid bone. It has two lamina. And it's separated by a septum. A plate. So it has a plate here and a plate here. So it is actually a little cross beam. A plate can take a shear stress. For instance, you see people with their hands break a board. The hand then is a shear. As long as but if they put it like this, it won't do it. So they have to have it exactly in the shear position. So this septum of the nose, this bony septum, perpendicular plate of the ethmoid, is continuous with the crista galli. Here's the perpendicular plate. Here is the crista galli. This is a shear plate. It will hold stresses front and back and up and down.
前後それから上下の力を受けることができます。プレートはこの横方向のストレスには弱いんですけども、縦横で上下前後であるんです。
Now the two sides of the labyrinth, they're covered then by the lamina papyracea. And so there's not very much stress coming through this area. It just is a filler. So this is the makeup of this bone. Now, coming in from the top, where those holes are, is the olfactory nerves. Olfaction is a very early function. You know, sharks smell blood in the water.
サメは水の中でも血液をちゃんと嗅ぎ取ります。
It's sensory chemical change in the air or whatever. A dog can smell 2,000 times better than a human. They have a lot of nose. They have a long snout, so they have a big ethmoid, and a good part of their brain is associated with olfaction. It's also interesting how near the sense of taste goes along with olfaction.
それともう一つ面白いんですけども、味覚というのも嗅覚に非常に密に関連があります。
The fact is, you knock out olfaction and you've knocked out taste. Again, I have to recall clinical experiences I've had. I was based in Key West, Florida, and I was a dentist in the Navy. The year was 1946. I had to take my turn on medical duty. So any accidents or anything like that, I had to take care of when they would come in if it was my turn on duty. So it was a good experience for me.
そういった意味ですごくいい経験でした。
I had sea duty on a submarine. I was a medical officer on a submarine. One day I was didn't have the duty, but a friend of mine who was a physician called me, asked me if I could come in and help him.
で、ぜひ来てちょっと助けてくれと。
He said he had a patient with a chronic nosebleed and he couldn't get it stopped. So I went in and I inquired as to what had happened. This boy had been in a bar.
行ったんですけれども、そしたらこの兵隊さんですけども、あるバーに行って飲んでたんです。
This particular person
で、その人は
had very receded orbits. His eyeballs were actually sitting well forward in the socket. I don't know how it can happen, but at any way, he hit him and hit him on the eyeball, and he crushed in the lamina papyracea. The kid couldn't focus his eye.
そうすると目の焦点が合わなくなってしまいました。
It was his left eye. So what are we going to do? His nose was bleeding and he couldn't see straight. So immediately I said, well, he must have broken his lamina papyracea. The physician forgot all of his anatomy.
多分このラミナ
So he said, what's that?
で、私がそういうふうにアドバイスすれば一体それは何だと言われまして、
So I explained it to him.
で、私説明したんです。
Now if you look inside the skull,
で、この頭蓋の中見ていただきますと、
if you notice, that's not very much of a space
あんまりスペース空いてませんけど、
between the lamina papyracea and the middle concha. So that's not very heavy bone through there.
それほど大きな骨、重い骨ではないわけです。
But it does give an attachment to the medial rectus of the eyes here. So we sprayed his nose with some antiseptic and with some anesthesia. So I took his burnisher and started packing in gauze.
で、ガーゼをこの充填し始めたわけです。
So I kept pushing it around.
で、どんどん詰めてきました。
Look now, is it better? Yeah, it's getting better.
で、良くなったかと言いながらどんどん詰めてたらばいいって本人が
I
言うん
kept
です。
packing away. Finally, he said, "Yeah, it's about right now."
で、大体こんなもんでいいと本人が言ったところでやめました。
So just with packing, apparently he'd pushed the thing in. So I packed it back out, and we let the pack in overnight. But he left, and he apparently got all right. That's before I even got in orthodontic school. Another one was the boys get careless in going down the hatch. If you know what a submarine hatch is.
もう一つこんなこともありまし
It
た。
has a rim in metal.
潜水
So one day this boy started to go down the ladder and he slipped.
で
He had his hands back here so that he could hold on to the rails,
で手で手すりを押さえてた。
but he slipped and fell.
でもこうやって滑って転んで落ちてしまいました。
Hit his face on the rim
で
of the hole, the rim of the.
でこうそのはしごの通ってる穴の端のところに顔をぶつけてしまいました。
Half-inch piece of metal,
金属のところにぶつけてしまいま
and he
した。
hit it right here.
ここでぶつかったんです。
So he hit it here and cut his lip in two,
でここも
and his lower front teeth were over, sticking through his lower lip.
でこうやってずっと切れて、
He knocked out two lower teeth,
科学は2本の折れちゃって、
and he caught both bicuspids on one side and one bicuspid on the other.
それから上の方は変則では小臼歯2本、反対側で1本やっぱ
Took
り
all
ぶつ
of
かっ
these
て、
teeth up,
で上にずっと上がっていったんです。
and he had teeth in his orbits. You can imagine how the whole weight of your body,
もう体全体の体重がかかったん
a
です。
piece of metal like that,
メタルにぶつかっ
wasn't going to give
て、
any.
で向こうは
He never had a cavity in his mouth.
で
I
今
started
ひどい様子でした。
cleaning him up, you clean it up.
でまあいろいろと処置をし始めました。
Tried to save some of his teeth, but they were all crumpled up and everything. So I just ended up losing all these teeth, sewing him back together, sewing his lip up. As soon as he got healed up, we made him a partial denture.
で
And he went home for Christmas, and his parents didn't know that he'd ever had an accident.
でクリスマス
So that was my major surgical case when I was in the service.
私
I had one other one
もう一つありました。
that was a very interesting case to me.
これは非常に
A boy had had a normal occlusion.
である男子なんですけども、口語は正常。
And all at once he found that he couldn't get his teeth together.
ところが
I don't know how many of you have seen this, but I've seen it maybe a half a dozen times in my career.
こういったこと
He was based up along the coast someplace, and I don't know why, but I had a reputation when I was even in the service,
で
because I had decided I was going to be an orthodontist when I was a sophomore in dental school.
というのは
And I was using the edgewise appliance when I was a senior in dental school. The only one in the history of the school that was ever permitted to work on people with an edgewise appliance as an undergraduate student that I knew of. It was only because I made such a nuisance of myself that they let me do it. Anyway, they had sent him down, flew him down, and he appeared in my office.
でこの
All right, close down.
で閉じてと言いまして、
Close down. And I looked, and he was only hitting his second and third molars.
そうする
And so I began to inquire. I said, now, have you had an open bite all your life? He says, no.
で
And I believed him because he had wear on his teeth.
でそれは
You could tell that at one time that they were together.
一時はちゃんと合わさっていたということを見れば分かりました。
So I began to get a history of it.
そこで
And his bite started to open when his third molar started coming in. Now what happens in him and in other cases is that they develop a pain, they develop a pericoronitis or an operculitis. When that happens, the patient won't close down because it's painful.
で痛いですから、これが始まると並行しなくなります。
So what they do is to stick the tongue in to cushion
でクッションにします。
and to protect them from biting down on that painful spot.
そうすれば
Now with a failure to close, what's the tooth going to do? It's got an eruptive potential anyway. What is the force of eruption? Do you remember Mura's work in 1973? He's a brilliant little guy, I'll tell you.
三浦藤夫先生、素晴らしい方なんですけども、
Nice work.
優秀な先生です。
Remember the experiment that he did with a rabbit? He put a pen or a little rod in the snout of the rabbit, and then he put a little strain gauge down against one of the incisors, using the other incisor as the control. He studied the eruption then of the incisor of the opposite side. Now he found with a force of 3 grams that he could slow the eruption down of a tooth. When he increased it to 5 grams,
これを5グラムにすると
it stopped the eruption altogether.
放出はまた
When he went to 7 grams,
次に7グラム
the tooth started to intrude.
そうすると
Now, taking the cross-section area and using a little bit of deduction, and you will see when we hand the second part out that we have rating scales that we rate the human teeth with,
これもう少し
based on the on-face surface area in the direction that you're moving a tooth. On-face means just the silhouette outline, or like a shadow.
Yeah.
Based on that, in the direction that you move a tooth. Now, using that experiment that he had and calculating, write this down. As nearly as I can determine, the force of eruption is 2/10 of a gram. I'm sorry, 2/10 of a gram per square millimeter of on-face surface. On-face surface of the root. Therefore, the force of eruption of a third molar, depending upon its position and the size, would be from 15 to 25 grams of force. So there is a force of eruption, and we think that we know pretty much what it is now. As studied by Mura and reported in the European proceedings of the World Congress meeting in 1973. In other words, if normal function had been there, it would have opposed the super eruption of those molars. But because they're painful, and the patient then protects cushions with the tongue, now they're permitted to come in unopposed. And so they can super erupt until they reach an appointed resistance. So I remember having that patient experience that, and I've seen it several times in my own practice. Now, one of the problems that happens is that the joint begins to get involved, and this is how I happen to see them. Because now they can't chew well, and they have an interference in the back of the mouth, and it begins to wrench the joint a little bit. Wrench, twist it.